Commissioner Jan Malcolm. Following Commissioner Malcolm, we will have updates and thoughts from State Epidemiologist Dr. Ruth Linfield. After that, we will turn it over to questions for reporters on the line. With that, I'll turn it over now to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Again, sorry for the disrupted schedule a little bit today. We do want to talk some about the data in Minnesota today because it does underscore the volatility of the situation that we find ourselves in, I believe. I'll start, as usual, with the global and national picture. As of early this morning, we were at more than 5.1 million cases and 333,000 deaths around the globe. In the United States, this morning we reported 1.57 million cases and more than 94,700 deaths. Here in Minnesota, we have a record high number of new cases for the day, up more than 800 cases from the prior day, which was a 60% increase in one day in the number of cases reported, so that we are now at 19,005 total laboratory-confirmed cases. So that large increase over yesterday ended rather abruptly the 6-day falling trend we had seen. I think I had mentioned on yesterday's call, in yesterday's briefing, that we didn't expect that trend to continue, but it's still concerning to see such a large jump. Now, certainly, some of that, but not all of that, is due to a higher testing volume yesterday. But as we have continued to say, the more we test, the more we expect to find, and that's a good thing because it's so key to the strategy of both knowing what is the status of the epidemic in Minnesota and how can we most appropriately focus on the areas that need containment. But I just really did want to draw your attention to the fact that our falling trend has spiked upward in a very significant way yesterday. Sadly, we also had our highest daily total yet of deaths at 33 additional Minnesotans dying from COVID-19 disease yesterday in Minnesota, bringing us to a new total of 842 deaths. 16 in Hennepin County, 7 in Ramsey, 4 in Anoka, 2 in Washington, 1 each in Stearns, Dakota, Goodhue, and Wright. This total includes 80 persons in their 90s, 13 in their 80s, 3 in their 70s, 7 in their 60s, 1 person in their 50s, and 1 person in their 30s. 27 of these 33 deaths occurred in residents of long-term care facilities. I will note here that in accordance with a proclamation issued by the President, Governor Walz has directed this afternoon that all flags at state and local buildings be flown at half staff effective this afternoon and through sunset on Sunday, May 24th, in memoriam and in honor of those that we have lost. Individuals, businesses, and other organizations are encouraged to do the same. There are currently 534 patients currently hospitalized. There's actually a net decrease of 32 over the prior day, but an additional 4 persons now in intensive care units, so a total of 233 COVID patients in intensive care units. And indeed, a couple of the hospital's intensive care units are getting quite full at this stage. So important work is going on in discussions around the community about how best to collaborate to even out some of that ICU need. We've spoken before about the uneven nature of the impact of COVID-19 and how it hits some populations harder than others, and in the process making worse some long-standing health disparities among persons of color and the indigenous population. We talk about these data every day, but sometimes in a day-to-day sense can lose sight of the larger trends. I saw this data the other day and it really struck me. We know that Minnesota's African-American population represents just a little bit over 6% of our state's overall population. On May 1st, we reported that African-Americans were indeed seeing a disproportionate burden, comprising 14% of the total state COVID cases, so well over their representation in the population as a whole, more than twice. Today, as of May 22nd, African Americans comprise 23% of the total state COVID cases. So that disparity that we had seen and have predicted is indeed continuing to accelerate and exacerbate. So that is something just very important to keep in mind as we talk about the burden of the disease and how it is distributing across our community. I mentioned that we had an uptick in testing volume yesterday, which again we expect to have some impact on the number of cases reported each day, but we had an increase of about 1,200 more tests yesterday for a daily total of 7,415, which is one of our higher totals. And even better, I think we averaged just about 7,000 tests every day over the last week. So we're definitely moving in the right direction with respect to making testing more available, which is so key to our goal. I'll mention also that we're making good progress on keeping up with the testing volume. We've talked a little bit and certainly can talk more in future calls about what we're doing to build up our capacity to do the case investigations and follow-up and contact tracing, which are so critical. But it isn't just testing for testing's sake. It's testing so that you can follow up and help to protect people by helping them to isolate and quarantine to protect themselves and others. So to that end, I'm delighted to say we are making good progress on that part of the picture as well. But back to the overall importance of the testing, tracing, isolation, and quarantine strategy that the governor and indeed the entire nation is laying out as so key to the successful control of this virus. As many have said, we need to learn to live with this virus. It's going to be with us for a while. So these basic public health strategies are going to be very, very essential to our ability to do that in as safe a manner as possible. So I'm really glad to tell you that we're not only growing our capacity for testing with our healthcare system partners, but also beginning to do more community-based testing. This weekend, Minnesotans who want or need to be tested for COVID-19 will be able to access free testing with no barriers at 6 National Guard Armory locations across the state throughout the holiday weekend. I believe a press release has just gone out just in the last few minutes announcing this. That the Minnesota National Guard members are supporting this mission and will have the capacity to collect roughly 2,000 samples a day across the 6 sites. So we're hoping that Minnesotans will take advantage of the ability to go to one of these Guard Armory locations for free testing. We appreciate the partnership of the Guard. The sites are being set up as a partnership between the Guard, the Minnesota Department of Health, our local public health partners, and the State Emergency Operations Center, which, as you know, is the central coordinating arm for the majority of our COVID-19 operations. So starting tomorrow, Saturday, May 23rd, through Monday, May 25th, these Armory facilities will be open to testing from 10 a.m. to 5 p.m. on each of those 3 days, Saturday, Sunday, and Monday, or until supplies might run out at any given location. So these Guard Armory stations are in East St. Paul, Minneapolis, Moorhead, Duluth, Faribault, and St. James, and the specific addresses are on the press release. And as a reminder, how important it is that people who have symptoms of COVID-19 can and should be getting tested. And when people have been tested, while they're waiting for their tests, after they know they're positive, or if they just feel sick and haven't yet been tested, they need to self-isolate, which means staying at home, which is just such a central element of our Stay Safe Minnesota strategy. And all of us can do our part by really taking that guidance to heart, that we just do not circulate in the community when we're ill. So with that, I'm going to I appreciate Dr. Linfield joining me today as a resource for your questions. I'll see if Ruth has any comments she'd like to add, and if not, we'll open it up.
The only thing I would add is really to ask you for your patience. As Commissioner Malcolm said, this virus is going to be with us for a while, and we all depend on each other to really be very careful about social distancing. And as Commissioner Malcolm also said, that when you're sick, please, please stay home.
Okay, Mike, we'll turn it back to you to open for questions.
Thank you, Commissioner. We will open it up for questions now. As always, we ask that recorders limit questions to one primary and one follow-up so we can get to as many as possible. With that, operator, we are ready to take questions.
Okay, so at this time, we are now opening the question and answer session. The first one is from Bill Werner from Minnesota News Network. You are now live.
Hi, thank you, Commissioner, for taking the question. And this may not be your direct wheelhouse, but I need to ask you this one anyway. What's the status of negotiations as far as reopening church services in Minnesota? It looks as if the comment that the president made this morning about demanding that they be reopened and that if local officials don't override them, that has at least put things somewhat in a state of flux. I know there was initially something planned for this time with the governor, and it got at least canceled for now. Please give us the latest on that and what the governor's stand is on this and what's being asked for in negotiations, if you would, please.
Certainly, and yes, I think we are all anticipating seeing if there is and when there will be any additional guidance from the CDC in keeping with the governor's statement today that churches are to be considered essential and therefore open. We certainly think public health guidance will be necessary to help those settings be as safe as possible, given that we are still in an actively growing pandemic, certainly in our community and in many communities. Yes, the governor has been in dialogue with faith leaders, and I believe he may have a statement this afternoon about the president's statement and indicating the fact that he is in dialogue with those leaders. So definitely we'll see what the CDC has to say, if anything new. I mean, certainly their guidance as of March was, very much kind of in keeping with our own, a strong preference for small gatherings and mostly outdoors and really limiting that in-person indoor contact. But we shall see if that changes. But certainly that will have a bearing on the governor's discussions with the leadership.
Will the state health department agree to what CDC guidelines are, whatever the changes are, or will you do you have any indication of that at all?
Yeah, well, we've always looked to that as an important reference point. I was just reserve the right to see what we think of that guidance when it comes out, and it's possible that we would have some suggestions that differed in some ways from the CDC, but again, we need to wait and see what that is.
And just for our planning purposes, you anticipate that discussions with faith leaders will continue over the Memorial Day holiday. Do you have any indication of that, Commissioner?
Yeah, yes, Bill. I think those discussions have been ongoing, and I think are expected to continue. As I said, I believe the governor's had planned to make a statement about the president's statement this afternoon. I have not seen it yet, but it may already be out. But I would think that statement might just speak to the fact that those conversations locally are continuing.
Okay, thank you. I don't think we've seen it here yet, but thank you, Commissioner. I appreciate that. Thank you.
Next one on the line is Matt Sepik from Minnesota Public Radio. You are now live.
Hi there, Commissioner Malcolm. What is causing the jump in cases in Rice County, and what sort of contact tracing efforts going on there? And how much and how many of these cases may be tied to the Jenny O plant in Faribault?
Well, thanks, Matt. And we do not have Chris Erzman with us today. She has got the day off. Chris would have that at her fingertips, I'm sure. I know that there do continue to be activities around some of the food processing plants. I think we're up to 9 counties now with cases involved with those plants. In terms of rice, I don't know if Ruth has any indication about that. Sorry, we're not as good on the spot as Chris on that. Sorry about that.
Well, then I'd like to ask a follow-up to what Dr. Linfield said this time last week regarding multi-system inflammatory syndrome in children. Have you been able to identify or confirm any cases of that among children here in Minnesota?
Yeah, thank you for the question. We did receive notification of a possible case and are obtaining the medical records and reviewing to see if the child meets the case definition. So more to follow.
Okay, thank you.
Yeah.
Next one on the line is Jeremy Olson from the Star Tribune. You are now live.
Hi, I wanted to ask about hospital capacity. Our numbers of ICU bed patients with COVID are up, and this week our metro hospitals reported being on and off divert status quite a bit, having most of their ICU beds used. They're opening up new COVID units. ECMO machines were used. It all points to a busy time, maybe because of COVID, but also maybe because we've had more surgery patients recovering, and that's clogging up the hospitals. I guess I'm just wondering if you have reaction to that, whether we've opened up our hospitals to surgeries too soon, and just to the impact of the broader pandemic on these hospitals that are apparently filling up.
Yes, thanks. It certainly is not completely unexpected. I think that the whole reason that the surge planning was done was in anticipation that case counts were going to continue to grow. What I can tell you is that there's good collaboration among the hospitals to help kind of even out some of that capacity. And yes, it is the case that in the metro, most of the hospitals are getting tighter on ICU beds. I think they're at the threshold of about 5% of ICU beds being available, and those are the regularly staffed beds, not the surge beds. But they are running tight on their established capacity, and we do think that that's due to the continued, it's been measured, but a steady increase in COVID patients, as well as other serious conditions and surgeries restarting. That is correct. And that's part of why the guidance around the reopening really stressed the importance of keeping an eye on the ability to both meet the needs for critical care and things like personal protective equipment for that increased patient load, but also with an eye to what may be coming in terms of additional COVID cases, such that all the health systems are certainly well aware that those elective procedures may go kind of on and off as capacity allows. We've talked before about the fact that we have this statewide healthcare coordination center that works right at the State Emergency Operations Center, and they've been in close contact with the hospitals on this issue. And they know that we're at that point and anticipate that this sort of daily load balancing is going to be an important function. And they now have a daily call to monitor and help troubleshoot and assist in movement of patients where necessary. So I think, the system is working as a whole system, which is what it's intended to do.
Quick follow-up then with respect to these beds that could be stood up in 24 or 72 hours. Do you have confidence, A, are you already taking efforts to get those going, to open those up, and B, do you have nurses and staff available? I mean, some of the nurses that might have been able to help were the surgery nurses who are now back to work. Do you have the staff to pull this off?
Yes, great question. When the hospitals identified their surge capacity, that was assuming staffing. So if staffing should change, then the surge numbers would change as well. But I think the surge numbers remain as they were originally stated to be. I'm not aware that any of the hospitals have opened up their 24-hour surge beds. They may be doing that. That would be their decision. You know, certainly they were in consultation with each other through the statewide healthcare coordination center and Dr. John Hick, whom you've heard from on this call. But that would be that's really their call when they see that necessity. Dr. Hick might, from his perspective, be suggesting they look at that, but that really is happening on those daily calls.
Thank you.
For the next question, we do have Kent Erdo from Cara Television. You are all live.
Interim guidance for places of worship, communities of faith. It appears to be, they say throughout, it's non-binding guidance, and a lot of those things that are suggested are considerations. It does have things like consider limiting the amount of singing and other activities. Can you talk about how Minnesota would potentially layer on top of considerations like that? What are some of the priorities the state would have if institutions are trying to rapidly start opening even this weekend with this kind of mixed message we're hearing federally and across the state?
Kent, I missed your first few words. I think you're asking about the last CDC guidance, or have you seen something new come out?
It appears as though they've updated their interim guidance for communities of faith, and I don't expect that you've seen that, but what I'm saying is it's very much saying it's non-binding guidance, and these are considerations to keep in mind. Certainly the state's prerogative has been a little bit more forceful in saying whether they should open or not. So are there some rules for worship that certainly the state is looking at putting into place or wanting to have in place for churches?
Yeah, thanks. I think that was why I sort of suggested earlier that we would want to reserve the right to maybe be a little more specific in our guidance, depending upon what the CDC might come up with. We think, and I'd invite Dr. Linfield to comment on anything she knows about any of the studies that have been done. There have been some well-publicized and researched outbreaks associated with places of worship, which has led to some of the concern about the importance of strong social distancing, really, frankly, still continuing to discourage people at higher risk from attending in-person services. We, from an MDH standpoint, will continue to strongly recommend very good social distancing, limitations on numbers of people, limitations on activities, such as no direct person-to-person contact, no singing, painful as that is. The data is pretty darn clear that talking and loud talking and singing are really pretty important transmission risks, especially again in close quarters. So we will continue to emphasize those ways of minimizing the proximity and the length of contact between people. And again, we just for our part, we will just continue to stress the value of using the safest possible ways of engaging in religious services, which still to this point are remote, or in some of the drive-in services that have popped up in some places where people are in their cars but together in a sense. as well as outdoor gatherings. Although those we believe should remain size limited and a reasonable size as well. So again, we'll be looking at the CDC guidance and refreshing our own, but we will intend to continue to be pretty specific with our recommendations.
What would you tell Minnesotans that are seeing the news today from the president encouraging that churches open now as soon as this weekend, and maybe they're hearing from their faith leaders that they will defy the governor's orders and open up with distancing? What would you tell Minnesotans as far as where the state stands on that right now and in light of all of this going on?
Well, I guess I would tell them, we're continuing to look at this. I know the governor's thinking about it. I know the governor's going to be in conversation with faith leaders. We will continue to give them our best advice about the risk of large in-person gatherings and our strong counsel to try to avoid large, close proximity crowds, especially of vulnerable people.
Next one on the line is Chloe Rosen from WCCO TV. You're now live.
Hi. My question is just regarding something. Can you hear me? That was said today during the White House press briefing. Dr. Birx had mentioned that Minneapolis has one of the highest COVID positivity rates as far as a metro area, right behind Chicago, Baltimore, and D.C. I'm just wondering if the Minnesota Department of Health is working with Minneapolis to bring down those case numbers and what that might look like.
Well, yeah, that's one of the reasons that we wanted to continue to point out that the case numbers can be fairly volatile fairly quickly, and we've actually had a couple conversations with Dr. Birx and Dr. Redfield at the CDC, and appreciate their attention to this as well. They have access to some data that we have not seen, so it's great when they share with us whatever indicators or whatever formulas they're using that kind of puts things on their radar screen. We've had good conversation and talked about the fact that some of our case positivity rate is, as we've talked about, because we are intentionally testing in known higher risk situations, long-term care, other congregate settings. So, I think we had a good conversation, and they were, we were all looking at and agreeing on the same general things. I certainly invite Dr. Linfield to chime in on the conversations she's had with colleagues at the CDC. But I think the strategy remains the same. We need to get our testing numbers up, particularly among populations that have perhaps not been as able to be tested, not as connected to health care. That's why we're enthused about getting these community-based testing strategies going, specifically reaching out to under-tested communities so that we can find and respond to where these pockets might be. Dr. Linfield, do you want to chime in at all?
Sure. As folks know, there have been some large outbreaks associated with various workplaces as well as outbreaks in long-term care facilities. And certainly some of the people who work in these settings then go home to their household, and there can be transmission within a household and then transmission within the community. And I think that's what we're seeing. If there's an outbreak in a particular location, it doesn't just stay in that location because people move. And that really is a reminder for all of us, again, that this virus is here and that we need to really take social distancing seriously And it is also a reminder that there are those among us who will not do well with this virus and who will develop severe disease. And I think we need to be very mindful about it. I mean, it's not high tech. We know what to do to prevent transmission of this virus. And we need to remind people that infected individuals can have virus in their upper respiratory tract before they develop symptoms. And they are able to transmit that virus before they develop symptoms. And some don't develop symptoms. And it is because of that that you really can't be sure if you don't have any symptoms, that it's okay to go and spend time with friends. We want people to spend time with friends, but we want everyone to be safe. And we have to take it seriously. I mean, to have Dr. Birx call out Minneapolis and to receive a phone call from Dr. Birx, and I received a phone call from Dr. Redfield in which they expressed their concern about the metro area. And we are concerned, and we all have a responsibility to work together to really try to keep tabs on this virus.
Great, thank you.
Thank you.
For the next one, we do have Dave Orick from Pioneer Press. You are now live.
Yes, hi. One very quick question on the National Guard Armory tests. Are they drive-through? The news release does not explain the interaction between the people who go and the actual test tape.
I am not sure if they are drive-through or walk-up. I think it is not just drive-through, but I apologize. I don't have that detail. Perhaps we can even chase that down and answer that question while we're still on the call here, whether it's drive-through or not. We'll see if we can get you that answer. But again, the six sites around the stage.
Okay, thank you. And since that was such a quick one, I get to cheat and take a slightly unrelated follow-up. As a public health official, you're faced with a situation where you are recommending that everyone wear a face covering. Mayor Fry is making it mandatory for indoors starting Tuesday, as you know. But the reality is that there is a partisan aspect to this. And I've been speaking with Republican lawmakers who say it should be a personal choice. How do you grapple with that, Commissioner Malcolm?
Well, I certainly think I would love it if we could just sort of rally around what we are getting better evidence of all the time. That is a protective measure. I understand the personal choice argument, but the data are really pretty good. That everyone wearing source control face masks helps to protect each other, and it reduces transmission to a significant degree. And the more people wear them, the more that is true. And I think what we're encouraging is for people not only to think about themselves, but their neighbors and the impact of our individual decisions on each other. To that extent, it isn't only a matter of personal freedom; it's a matter of the impact that we have on each other. So, certainly, I think that is one of the things that has gotten clearer in recent weeks. The consensus is getting stronger and stronger that masks, while absolutely not a panacea, not a guarantee, and one thing we keep reinforcing, we worry that people will think, well, if I'm wearing a mask, even if I'm not feeling so good, that's okay because I'm wearing a mask. That's not the message. It's not wear a mask and then all other rules are off. But in combination with keeping a safe social distance of 6 feet at least, and avoiding large gatherings and not going out when you're sick, all those things in combination really make a pretty dramatic difference in transmission, especially as Ruth just said a few minutes ago, when we know we have community spread, when we know there is asymptomatic transmission. It is common sense to do everything that we can do to protect each other.
Have you taken that message directly to, on a personal level, one-on-one with Republican leaders?
You know, one of the things that's just been unfortunate about this time that we're in is I have not had the chance to have as much conversation with our legislative leaders as I normally do. But that is, and quite honestly, that's something that I miss, just the normal personal interchanges that we're able to have during sessions. So no, I have not had those personal conversations, I'm sorry to say. I do, if I may, we did get the answer to the question on the Armory testing sites. They are not drive-through testing, so people will need to park or walk up and go inside the buildings. And it's not going to be such nice weather, it appears. So standing outside in line wouldn't be good for the guard, and hopefully getting tested, it will be something people will take seriously as an opportunity, and it won't be as tempting to be outside.
Thank you.
Next one on the line is Steve Gronowski from Associated Press. You're now live.
Yeah, hi. Just wanted to get your reaction to the State Fair's announcement today that they're canceling. And now that they've made that announcement, can you tell us anything more about what discussions that went on back and forth between the health department and the State Fair officials? You were kind of vague on that yesterday.
Steve, it sounds like the conference line may have been dropped, so we're going to have to pause just a second while they dial back in. I apologize for that.
Okay.
Operator, if you could prioritize getting them back on as quickly as possible.
Yes, 1 moment, please.
Thank you.
I hope anybody's still on the line.
We're still here, and if I could ask Steve to just repeat his question.
So my apologies. It just goes to show you I should not be left alone in a room with a telephone, apparently. I don't know the difference between turning up the volume and turning off the phone. My apologies, folks.
Okay, I'm hoping you can hear me now.
Yes, I
wanted
can.
to get your take on the official announcement today that the State Fair for 2020 is canceled. And if you can give us any more insights into the conversations between the health department and the State Fair about that decision. You were kind of vague on the subject yesterday. I think you were being diplomatic. Maybe you can tell us more today.
Well, I know for all of us Minnesotans, that's sad news that we won't have our fair this year. I did did have a conversation with the folks, the leadership at the fair, and their questions were really about, what we foresaw in terms of the progression of the disease, and did we think we'd be, that it would be significantly, over or different or lower risk by then. And we just simply shared with them our assessment that this is going to be with us at dangerous levels for some time. But it was their decision, and we certainly respect it and quite honestly appreciate it from a public health perspective. It's certainly one way to avoid what otherwise would have been a pretty predictable accelerator of community spread at a time when a lot of people are still going to be vulnerable to the infection. So just no way around it. It's just another sad indication of the disruption and the loss. And it's certainly a huge loss for the people whose livelihoods are tied directly to the fair, and a huge cultural loss for all of us. So there's nothing I can say other than that it's just another indicator of what a disruption and a harm this virus is causing.
Okay, so for the next one, we do have Jill Burkham from Star Tribune. You are now live.
Hi, I'd like to know if we are getting the amount of remdesivir that we need in Minnesota. Dr. Linfield has talked about getting multiple shipments, but I'm hoping for some context on whether, the volume has been sufficient for what we need in the state.
Thank you, Jill. It's a complicated question. I will first start by saying we did get another shipment of remdesivir this week, and it went out. We received it. Let's see what day it is today. I think in the afternoon on Wednesday, and it went out yesterday, and some of it went out via UPS. So facilities in Greater Minnesota should have received it this morning. There was enough to treat 159 patients with a 10-day course, certainly more patients if a 5-day course was used. And it is not enough to treat every patient in Minnesota who has severe disease. The federal government did not say that they would send out enough to treat every patient who has severe disease, because they only got a limited amount from Gilead. However, when we look at the people who are getting it, there are in some facilities still a number of people who are on remdesivir because they're on a clinical trial. There's been a trial looking at 5 days versus 10 days, so some patients still have received it that way. There are a few patients who are receiving the drug from Gilead for compassionate use. They are still making that available for pregnant women or children. And then there also are some people who don't want to receive remdesivir. It is not an FDA-approved product. It is under an emergency use authorization. And so when the clinician has a patient who meets the criteria, they discuss the situation and get consent or get consent from their next of kin if the patient can't provide it. So there are a number of patients for whom they would not be receiving the allocation. Still, having said that, we wish there was more remdesivir in the state, and that is why, from the very beginning, we knew that the interest might exceed the supply. And so we met with infectious disease physicians, intensivists, and then with representatives of the Minnesota COVID Ethics Collaborative to come up with criteria that people can use. And from the time that we received our first shipment, we had this guidance in place, and we sent it out with the first shipment.
Thank you.
Okay.
Operator, we have time for one more question.
Okay, so for the last question, we do have Sarah Kocher from St. Cloud Times. You are now live.
Good afternoon, Commissioner. I am curious. I know that in the past the Department of Health has cited access as one of the struggles in reaching hope for higher testing numbers, and you mentioned that again today, with the hope that the free testing would maybe increase some of that access. I'm curious if you're expecting to see higher testing numbers following the National Guard testing sites, and I'm also curious if you can comment about access in rural locations as well.
Sure. Finding ways to increase access to testing is certainly an ongoing priority for us. First, to make sure that people understand that the criteria for testing has been broadened significantly. As testing capacity has grown in Minnesota, we want everyone who has any symptoms to be able to be tested. And we've sent out guidance to healthcare providers around the state to use very broad clinical discretion about what symptoms might be indicative of COVID. That's, as Dr. Linfield has said, Chris Erzman has said, we continue to learn so much about this virus all the time, and the fact that it can present with different symptoms than were the classic ones that we first thought. So we're really encouraging clinicians to use broad clinical discretion and test anyone who's symptomatic, but also to test asymptomatic people who are coming in for things like elective procedures, and we are now beginning to do more what we would refer to as kind of surveillance testing, like these clinics, these armory clinics are not screening out people for symptoms, but testing anyone who comes in, partly as a way of saying, what do you get when you just test a more general population that is willing and wants to be tested. So continuing to make sure that where there are barriers, we understand what they are. Are they barriers in testing supplies? Are they barriers in people being able to get into a clinic? Hence the value of mobile programs or sites like the armories. We do think we've learned from other states that having some sites not connected to healthcare facilities is a good thing. Creates more volume capacity and possibly easier for people to get to. Some drive up in a shopping mall lot or something that's easier to get to than their clinic. So we're going to be exploring all kinds of ways to try to make access easier for folks, and including, in this case, making sure that there's no financial barrier. I mean, the health plans in Minnesota have been very good about saying they are going to waive copayments for testing for COVID, and so cost. It's our goal to make sure that cost is not a barrier to anybody to get tested.
Thank you, Commissioner.
All right, that is all the time we have on today's call. I want to thank our speakers and the reporters on the line today. If you had a question we were not able to address during the call, please feel free to reach out to our communications office. Have a good day, and we will talk with you again soon.
This has been a WDIO News Special Report.